Madam Clerk, you are prepared?
Yes, Madam Chair, I am ready to go whenever the board is ready.
Fantastic. I'm going to change my background here real quickly because we probably need that. All right. Good morning, everybody. Welcome to the Monday, April. I don't have my glasses on. Today's what? The 6th? That's bad that I can't see the sheet in front of my face. April 5th meeting of the Community Homeless Advisory Board. At this time, we will start with the Pledge of Allegiance. And if we could get Member Dare, would you like to lead us in the pledge?
Honored to. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Madam Clerk, if you'll please take the roll.
Yes, Madam Chair. Roll call for the Community Homelessness Advisory Board. Jarden,
Here.
Delgado,
Here.
Lawson,
Here.
Here,
Here.
Hill,
Here.
and Lucy is absent at this time. Madam Chair, you do have a quorum of the CHAB meeting today.
Thank you very much, Madam Clerk. At this time, we'll move into item 3, which is public comment, general public comment. Madam Clerk, do we have any general public comment?
Madam Chair, the item under item 3 for public comment is reserved for general public comment not pertaining to any specific item on our agenda today. We did receive one public comment in the afternoon sent through an alternative channel. It did go through our webmaster, so that was just relayed to me this morning. However, that message is from Kathleen Maxwell with various concerns on public porta potties and restrooms. That has been submitted to the board and is part of the official record and will be included with the minutes of this meeting. With that, Madam Chair, you have no further general public comment today.
Thank you very much. Item 4 is the approval of the agenda. Does anybody have any changes? And if not, may I get a motion?
I'll move.
I have a
Second.
motion and a second. All those in favor say aye.
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 Any opposed? Hearing none, motion carries unanimously. Item 5, approval of the minutes.
Motion to approve.
Second.
I have a motion and a second. All those in favor say aye.
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 Any opposed? Hearing none, motion carries unanimously. All right, item 6, presentation from Grace Marketplace in Gainesville and Alachua. Hope I didn't kill that. Very excited about this presentation. Madam Clerk, if we could move over the presenter.
At this time, Madam Chair, we will move over. Checking my notes, I apologize. John DeCarmine, the Executive Director. And Mr. DeCarmine will be rejoining us as a panelist.
Hi, good morning, everybody.
Good morning, John. Thank you for being here. Welcome.
Of course, sorry, it just took me a second to get into presenter view. So let me go ahead and share my screen.
Great. We can see it and we can hear you.
Excellent. Okay, so good morning. As I was introduced, my name is John DeCarmine. I am the executive director of an organization called Grace in Alachua County, Florida. We are a one-stop homeless assistance center, a low barrier emergency shelter. We also run a number of permanent housing programs around the community. But why I'm here today is we've also developed a national best practice on not only resolving issues with homeless camps, but how to set up a camp that is actually driven by the stated goal of getting people into housing as quickly as possible. And that kind of camp sometimes can stand in contrast to really the quick solution to camps. And I think a lot of people currently are trying to figure out what the best quick ways to address homelessness are. And one option that a lot of communities are considering is how to set up some kind of encampment with the stated goal of how can we keep people safe while we're still finding ways to deliver other services. So I'm going to just run through briefly kind of a tale of two camps, because we have set up both kinds of camps here in Gainesville and Alachua County. And so just to start off, our communities are a little bit different in size, a little bit different in homeless population, but not all that far apart. So Alachua County is about 270,000 people. Gainesville itself is the primary metropolitan area there, about 160, 170,000 people there. We are the kind of area in Florida with warm weather and good services and a college town that people will often think of as the kind of place where homelessness exists, where it's easier for people to exist here than it might be to survive a winter in Chicago. We've got a homeless population of about 800 right now, based on our most recent point in time count, and that's down 36% since 2014 when we opened Grace, my program, and then the homeless camp itself, known originally as Dignity Village, had opened. And in the past 7 years, we've seen a 68% reduction in unsheltered homelessness, with the biggest, most substantial decrease having come from from closing the initial camp and creating a new camp that was driven by a goal of putting people into permanent housing. We've run the trajectory in how we approach homelessness. Gainesville was named the 5th meanest city in the country for how it treated homeless folks as recently as, I want to say, 2009. We have ongoing, sometimes imperfect cooperation between cities and counties. Currently, my shelter is started off being a 50-50 split between city and county government. We have now moved to the city of Gainesville operates or pays us to operate the shelter, and the county has created a corresponding permanent housing program. So we've gone from being managed by multiple municipalities to them each kind of finding their lane, where the city now funds shelter services and the county funds permanent housing services. And again, we did start Grace and Dignity Village in 2014. So this project has existed for about 7 years now. In that time, we've moved about 1,600 people into permanent housing. We have a housing retention rate overall of about 90%. That means 90% of the people I move into housing today will still be housed a year later. And we have reduced homelessness by more than 1/3 in that time. So I want to start off by talking about Dignity Village. And this is kind of that camp that municipalities create when they're not quite sure what else to do. This was designed to help the community answer some Pottinger decisions. And that is, of course, the Supreme Court case that tells us that we cannot tell somebody they can't stay outside or can't stay someplace on public property if we're not providing an alternative place for them to go. And back in 2014, the city and the county created Grace as that one-stop center. We did take over a former prison. So we're on about a 23-acre campus. And Dignity Village followed shortly afterward. There had been a 200-person tent city downtown, and there were, after years and years of issues, that we knew that was going to close. Dignity Village was created so that the government could come in and say to the people in that old camp, you cannot stay here, but there is a new place for us up on 39th Avenue where you can go. And they helped people move up there. And early on, we actually thought it was a great idea. We thought it was kind of a fascinating social experiment. You know, we were recreating a tent city with all of the basics of public health. So it wasn't just a place in the woods. It was a place where you had a place to use the bathroom, a place where you had a place to store your belongings, where you could throw out garbage without having to pile it up in the woods. And then it also sort of democratized access to public safety and public health measures. So it wasn't putting, for example, women in domestic violence situations in a spot where they were unwilling to report domestic violence for fear of getting the entire campsite evicted. So it started off as a great idea, and it started off with about 30 people in the camp, and very quickly grew to 50 people and 100 people and peaked at just about 300 people. Over the course of Dignity Village's existence. It served more than anything else as an out of sight, out of mind, I'd put air quotes around solution to homelessness in our community. It served its purpose in giving people a place to go. It served its purpose in reducing homelessness to an extent, visible homelessness in the downtown area. But it had a lot of unintended consequences as well. So you'll see on the slide about a $400,000 annual investment from the city of Gainesville to just manage this camp. That number does not include about $500,000 in EMS costs that were largely uncompensated every 6 months. The $400,000 investment was primarily some operational costs, some facility costs, and then the cost of 2 Gainesville Police Department officers and 1 program manager to staff it, which was very much an insufficient amount of staffing. Back more towards the social services side, what we found was that the presence of this camp kind of created a disincentive for a lot of folks to work toward housing placement for themselves. You know, it's kind of the same reason you don't host a meeting of Alcoholics Anonymous in a bar. You're trying to create a good way forward for people, and people still have some other options that they can pursue with this kind of camp. And we would end up, you know, you could see this camp from our shelter front door, and we'd be having conversations with people saying, hey, we're ready to go. Let's start working on housing. We have all these things in place. How can we move forward? And they're going to say, well, hold on a second, because they could look across the fence and they would see some people playing guitar around a campfire and drinking some beer. And they'd say, I'll be right back. And they would never come back to the shelter. We lost a lot of opportunities to engage with them just on account of some easier alternative being present there. At the end of the life of Dignity Village in 2019, we had been dealing with a lot of violence there, a lot of ongoing issues, particularly related to drug activity, and some problems I think that came from never having gotten self-governance off of the ground. So we moved forward with a plan to close down this camp and to create as part of the closure, to create a temporary campground on our campus that would answer really that critical question of whenever you close a homeless camp, the first question people ask you is, well, where can I go from here? And of course, we knew the traditional model of closing homeless camps looked a lot like sending cops and bulldozers and telling people they had 20 minutes to pack up all of their belongings and go. And that wasn't good for anybody. That wasn't good for the people living there. That wasn't good for the community. And we knew that we had to find a better alternative than just displacing people and scattering them around town. So that brings us to the second camp that we created. And again, this was a very temporary camp with the intention of not only really refocusing the services provided toward permanent housing placement, but also answering that question of where people could go and finding a way that we could set up a camp and then close it as quickly as possible with the best possible outcomes. So about 6 months prior to closing Dignity Village, we started meeting with the residents and letting them know that this change was going to come. And we asked them how they would be most willing to move into a camp and work with us on housing. Asked questions like, if all of our policies stayed the same, and we are an extremely low barrier shelter, would you be interested in moving on to our campus as a temporary measure on your way to housing? And when we asked the question that way, about 56% of people said that they would be interested. When we added pet services, about 70% of people said that they would be interested. And overall, when we said, what if we also provided some opportunities for couples to stay together, which is a major issue in that not enough shelters typically provide services and allow people to show up as part of a household if it does not have children, that number jumped to about 70%. And from the beginning, we knew that we were going to run this camp based around a model of attrition. So that said, we created about 90 platforms for people. We brought in all of the tents, brand new tents to help incentivize people coming in. But we treated each one of those platforms very much like a shelter bed. So that means as soon as the individual on platform 10 got moved into housing, Platform 10 was taken down, the tent was taken down, and it was never filled again. So this from the beginning was a temporary solution where we could keep people close so we could engage with them, where we could deliver the kinds of services they needed to get into permanent housing, and where we would then take it down. It would not become a fixture in the community, but rather it was a tool for ending homelessness rather than a tool for managing homelessness. So overall, that looked like about 90 people on the campground. Again, that strong housing focus, a way to control who was coming in and out. And in the past 12 months, we've been able to close down 90% of that roster of the original number of people who had been in Dignity Village. When we finally closed that camp, there were 222 people there. To date, we've moved 129 of those folks into permanent housing, again, with that 90% housing retention rate. We did not have to arrest anybody. We did not displace anybody. There were about 60 people who just left town when we said, we're going to put some basic expectations around violence and safety into this camp. For about 60 people, they just took off. And those folks, we know they left town because our continuum of care covers a 5-county area, and they had not received a single homeless service in 5 counties over 90 days. That's how we determined that they left town. Right now, there are 25 or 26 people left to be housed 12 months in. And of those, 13 live on my campus in this temporary campground, and 12 did scatter around town. But overall, that's just about 5% of the total campground population moved somewhere else in the community, compared to that older model of just showing up with law enforcement and bulldozers and then saying, you've got to find someplace to go, in which case typically 80 or 90% of people scatter elsewhere in the community. Here's how that looks on a timeline. We had actually created the new campground leading up to the March 2nd closure of Dignity Village. We were aiming for a 50% reduction over 6 months and an 80% reduction over 12 months. We hit 89% reduction in the roster after the first 12 months. And with that, just want to very quickly run through the core components and then make sure I'm leaving plenty of time for any kind of questions that you may have as you're making some considerations in your own planning process. So what distinguished the second camp from the first one? So the Grace camp, the one that was actually effective in moving more than 100 people into permanent housing, started with resident input and making sure that we were setting up a campground that people wanted to come to, because we knew we didn't want to set up a camp that had hundreds of thousands of dollars in investment only to find out that it wasn't really what people needed. So for the 6 months leading up to this, we were talking about what kind of services people really needed and how we could include those. We have low barrier access to all of our services, both on the shelter side of things as well as into the campground. So we don't even require IDs or birth certificates for somebody to first move in. Instead, that becomes one of the first things that we begin to work on with them. The roster, we did have to close the roster. You know, you can't create a camp that is constantly bringing new people in while you're moving other people out if you're going to be moving towards closure from the first day. And so for that kind of ties into making sure you have control over people coming in and people leaving. You know who is there and you know when they're coming and going. All of this was built around having services available to people on their own terms. For us, it was a shelter that's just, 50 yards away from where they were. And then really drilling down on trying to divert as many people as possible. We touched on the where do I go part. When you're closing any kind of camp, you need to be able to account for the fact that human beings have to exist somewhere. But I'll tell you that as we went, the folks who had been in Dignity Village were ultimately left out there on their own for about 5 years. The 5-year period not only cost the city over $1 million in staffing costs and operational costs, cost us millions more in EMS costs, law enforcement response, and really inappropriate use of public resources. And when we first started, nobody there expected to be housed. People had sort of just said, well, I've been homeless here for 5 years, or I've been homeless here for 3 years. This is kind of what I do, and this is how it works. we have finally now gotten to the point where more people who were in that camp have been housed than have been left homeless. So it's changed the entire conversation where people were saying, gosh, I've been out here for a really long time. How can I get housed? What do I need to do? And how can I work with you? As we went through, we did say that as you leave the campground, if you move into permanent housing, you are giving up your spot in the campground. So you can always return to the shelter. You can always have access to a diversion. But at the same time, once you're housed, that campground, that tent is coming down, that platform is coming down. And so it became an opportunity for us to really make sure people were ready and to get them into housing as quickly as possible and then support them from that point forward. And then just last couple other tools that we used, dynamic prioritization was critical for this. So we partnered with our continuum of care. And what we said is that we identified that this homeless camp at the time was our community's biggest concern. It was our biggest need to appropriately address the housing needs of individuals living there. We worked with the continuum of care such that these individuals were prioritized through the coordinated entry process. That means all other things being equal, if two people with the same set of needs were showing up for coordinated entry on the same day, the person from the homeless camp would be housed first. And we did, of course, leave some opportunities for caseworkers to advocate for somebody else so that it didn't ever eliminate somebody's opportunity to be housed, but all things being equal, the folks from the camp were going to move forward first. We tied this into existing rapid rehousing and permanent supportive housing beds and used those rapid beds as a bridge to permanent housing. And we had full cooperation and law enforcement from the city and from law enforcement in our community, because we started from a premise that none of us wanted to try to arrest our way out of a problem that we knew could not be solved with law enforcement action, but instead had to be dealt with from housing. The only other key difference I really want to mention is staffing and what that looked like for the original Dignity Village versus what it looked like for Grace Camp. With Dignity Village, the staffing, as I had mentioned, was 2 full-time law enforcement officers and 1 program manager. And I think that says a lot right there. When we have double the number of law enforcement officers as we do social services staff, it kind of tipped the cards that it was more of a management of homelessness rather than an ending homelessness tool. When we set up the Grace Camp, we pretty much quadrupled the staffing of that. We had 4 full-time outreach / case management workers who were constantly going out. This is for 90 people, constantly working with people to move them along in the housing process, to connect them to coordinated entry, and to make sure that they had the resources that they need. And when we had just a short investment of 4 times as many staff members dedicated to ending these individuals' homelessness, we saw an exponential growth in the number of housing placements. Overall, though, the city was spending about $400,000 a year. For us to put that level of staffing in place cost $300,000 a year. So we were spending $100,000 less per year, and that allowed us to house more than 100 people in the very first year. So with that, I would be happy to answer any questions and move forward from there in any way that I can be of value to you.
Thank you, John. That was incredible. Thank you very much. I'm sure there are many questions and comments that our members would like to pose here. Member Dare.
Yeah, my question is, thank you so much. I think it's one of the things we want to try to take the best steps we can as we move forward. Did you have a housing problem? Like for us in our area, our problem, part of it is we don't have a place to bring people yet. We're working on that, and it's a big problem in our region here. Did you have that problem, and how did you solve that, or was that not part of the problem?
Yeah, are you asking if access to affordable, safe, decent housing was part of the problem?
Exactly.
That is very much part of the problem here. I've been a homeless advocate for 25 years at this point in my life. Do not know, and I've worked with dozens of communities, and I don't know any place that says, you know what, we actually have all the affordable housing and all of the permanent supportive housing and all of the rapid rehousing that we need. So we did leverage some existing relationships with landlords. We used a lot of diversions. Of those 129 people housed, the diversion program, and I know you're the Community Homeless Advisory Board. I'm presuming that you have some knowledge of this, but I'm happy to explain that if needed. But the diversion program itself, connecting people with friends or family elsewhere in the community or elsewhere in the country, made up at least 50 of those housing placements. So sometimes it was tapping into resources people already had. Sometimes it was developing new relationships with landlords. And then other times it was leveraging the tools that we have available for things like rapid rehousing, when we can say, I understand you might not typically rent to this person. However, we would be willing to pay a double security deposit, and we'll go ahead and pay the 6 months of rent right now. So you have a vacant unit, you can choose to allow that unit to remain vacant, or we can pay you 6 months of your rent up front. And that tends to open up a lot of doors with landlords.
I really like the focus of on anything we do, that it's not just to maintain people in a homeless situation, but I love that we are looking at trying to help them move into where they're securely housed. So thank you. I appreciate your expertise. Thanks.
Thank you very much. Do any of our other members, Member Hill?
Thank you, John. That was great. And I think my big concern with us looking at a safe camp for our community is that we will turn into the first version of your camp. And I think that the fact that you close down these locations once you've housed folks is a really cool way to ensure that we won't turn into that. Now, I think there is a misconception that I've heard from people in our community that there's just people who want to live in tents. And so I'm wondering if you could address that, or if you heard that, and maybe if your community has dealt with that misconception.
I am so glad you asked. Yes, that is true for about 3% or 4% or 5% of people. And I'll tell you what, I've been involved with our point in time survey for decades. We used to ask the question as a political, as a piece of political data, do you want to be homeless? And when we asked the question that way, about 80% of people said no way, which it looks like 20% of people want to be homeless. But when you dig in deeper to that, wanting to be homeless very often actually means, I think I've tried everything I can possibly try, and I've reached out to every possible social service agency to no avail. So it's almost easier to tell myself this is what I want, as opposed to continuing to try and fail for something better. When we went out and we changed that question on our point in time survey a couple of years ago, now we ask, if housing was available to you that was affordable and met your needs, would you be interested in moving into that housing? When we ask the question that way, about 94% of people say, absolutely, I want housing. I will do anything I can. I just don't know how to do it, which turns us to the social workers, the folks who are involved in this, and the support of local government and municipalities to say, how can we better support people in this transition? How can we hit that tipping point where more of your friends are in housing than are homeless? And how do we get there? So that's one of probably half a dozen different kind of red herrings that pop up in all kinds of community conversations. The other one is, gosh, if we build this, people will come. We haven't lost that field of dreams mentality that says, oh, people are hopping on buses right now to come to Gainesville, Florida, because we serve lasagna on Thursdays. People generally do what homeless people generally do what all other people do, and that is they will go to the place where they are most likely to meet their own needs or the needs of their family. I don't think that's something worth, that's fine. At some point we say, if that's what's going to happen, how can we be prepared at the front door to say, okay, you're here. Do you really need this resource, or is there a better resource that we can connect you with? We did find that there were about 30% of people in that original camp had come from outside of the area. And it's a little bit difficult for us to tease out what outside of the area means. We ask, did you live and work in our county before you became homeless, somewhere else in Florida, or somewhere else in the country? And generally, even when somebody came from somewhere else in Florida, they came from the 5-county area because we have more services here. And so we would try to get them connected back with their own communities as quickly as possible. It's imperfect. Different levels of government, different sizes of government can and will provide different levels of service. I don't know that that is an issue for homeless providers to sort out as much as it is for the local governments, but at some point we have to come down to the answer of how do we want to deal with what's actually happening, as opposed to, I wish it was different. I wish people didn't have to come a county over to get meals and shelter, but the reality is sometimes they do. So how do we take on the reality of that situation?
John, thank you so much for that. I do know those are comments. Listening to your entire presentation was so similar to all of the struggles and the things in which we're facing here today. I did have one question. I'm going to turn it over to Member Lawson. Actually, two questions. One of them is you talked about your point in time survey, and we kind of have a dual, I guess we'll call it a dual process. We have the point in time count, which is so under the HUD criteria, which is kind of a limited, number of questions. Do you piggyback on that for your point in time count, or do you do a separate process entirely with a questionnaire? Your questionnaire intrigues me because those are the questions in which, and I know Member Hill and I just had a meeting with a lived experience group of folks, who have walked in homelessness for years and years, and their feedback was so tremendous. How did you build about that survey, and how did you execute it?
So that's a big question. I will say to me, the only effective way to do a point in time is to get out on the street and to try to find as many people as possible in your window. We leverage that by primarily we hire homeless folks. There are no better experts in your community other than the people themselves to ride their bikes right into the camps. You eliminate all of those. I don't know where to look. I don't know who to talk to. I don't know how to approach them. So we generally budget, and I don't run the continuum of care. We used to, and then we handed that off as we became a bigger service provider. But we look at the HUD data, the HMIS data, and what we have to submit to them as a touching off point. And then we do this year as a COVID precaution, we only did these questions outside. We abbreviated the questionnaire that we typically use. And it's a balance of basic demographic information with some of those political questions that I know will come up. Did you come from this area? Do you want to be homeless? However you ask that. And then finding what we can find by going out. I will say point in time surveys are not scientific processes, but what we have done, we started doing them in 2003. And overall, what we can say about it is, while we know it's not a census, we know that there's no hope of finding each and every person. I tell people, I could put you in a Walmart and know that there are 400 people there. And in an hour, you wouldn't find all of them. You're always going to miss some people. But we maintain a consistent methodology from year to year, which at least gives us the benefit of being able to compare from one year to the next, since that methodology was the same.
I love that you hire the homeless to do that. I just love that. Member Lawson.
So John, I got a couple of questions. So what have you seen in your population? Is it decreased from the 800, or is it increased, or because you offer more services? Tell me where you are.
Well, what we have seen, so we had seen homelessness go up consistently from about 2008 to 2014. And there was a slight decrease in 2013. I typically measure from about 2014 forward. It is in my interest because I created the largest homeless shelter in the community in 2014. So for us, that's part of our outcome measures, is to determine, okay, we just increased the number of shelter beds by 135. We also we added 3 meals a day. We increased a dozen different service providers. Once we had done that, what we have seen is homelessness decreased by 36%. That's from about 1,202 people in 2014 to less than 800 in 2021. The homeless services come in all different shapes, and only 2 or 3 of those shapes tend to be really effective. The ones that are driven by housing, by outcomes. I tell people all the time, be incredibly wary of any homeless service provider who is not constantly telling you how many people they moved into housing. Because if I could tell you that we've served over almost 1 million meals, we've provided over 1 million services, but if each of those meals and each of those services were provided to a person who's still homeless, I have not done my job. So taking that and recognizing that a low barrier emergency shelter will always be a critical component of your housing crisis response system. But what happens when people get there is really what determines what happens next. Do you end up warehousing people where they stay homeless longer than necessary? Or do you work with them to get them out of homelessness as quickly as possible? So assuming that your services that increase are also housing focused and low barrier, you can, I guess I'll say in our experience, that has led to substantial reductions in homelessness as opposed to an increase in homelessness.
My second question is then, do you charge for the night stays or ask people to do certain amount of work around the shelter to keep your costs down, or is it just free and away you go?
No, sir, we do not charge for any of our services. I would be shocked if I went to a hospital to get cared for a heart attack and they told me I had to sweep the floors before they treated my heart attack. And likewise, when somebody shows up here in crisis, we do not ask them to do chores. We do not ask them to do anything other than follow 7 very simple expectations based around respecting the rights, peace, and privacy of everybody here. You cannot bring drugs or alcohol onto our campus. However, we actively serve people who use drugs and alcohol. It's the analogy I find most helpful there is I would think it would be ridiculous if I called my doctor and my doctor said, as soon as you're not sick anymore, come into my office and I'll treat you. But homeless services do that all the time. We say, as long as you have a job and an income and you're sober, then I can't wait to serve you. The reality is those are the folks who need our help the least. So we need to be tailoring our services to those folks who are most vulnerable, not least vulnerable.
Well, I'm assuming that you're not finding houses for these folks, within the first few days that they're there or month, that, there is a transitional type period there. And there is a point where they are stabilized. And so in between that stabilization point and finding permanent housing is so you're telling me there's nothing there at that point as far as requiring them to take out the trash or, work security for 2 hours a week or whatever it is.
Correct.
Okay.
Correct. And to the contrary, what we find is the most stabilization happens once somebody is in their own apartment. And in fact, it becomes a little bit unrealistic sometimes for us to expect, for example, again, I have 135 shelter beds. If I want somebody to work towards stabilizing a mental health condition, it's much easier for them to do that in their own apartment with a door they can close behind them and a place they can take a shower where they feel safe than it is for me to ask them to stabilize a mental health condition in a room where 134 other people were trying to stabilize a mental health condition. So I think often we mix up housing is part of the process and it is the destination, but it often leads to the kinds of improvements that we would sometimes require prior to letting somebody into housing.
So you don't have the transitional housing part of it is what you're saying. You go straight
correct.
from emergency shelter to permanent housing.
And
Okay,
sometimes we go straight to permanent housing from the street. And we do use that housing first model. That is not a housing only model. That's when the work really starts. But it is all easier and cheaper when we do it in somebody's home.
Okay, yeah, we're looking at the transitional housing portion of it. So maybe that's where I'm confused and I didn't get in your presentation. So thank you.
Yes, sir. Thanks for your questions.
Member Delgado.
Thank you, Madam Chair. More just compliments and appreciation for John and his work that he's doing in Florida. Just really, I think his concise deliberation and just advocacy for the vulnerable, I really, really appreciate. It's been a while since I've really heard the straight dig in terms of how we should kind of look at our models and also the bringing in folks that are currently in the situation to be part of the conversation. So thank you, hats off, John. I appreciate it. Hopefully I'll learn from his model and kind of consider that as we move into phase 2. But I just wanted to thank you for joining us this morning.
Appreciate that. Thank you.
Yes, thank you, John. And you've come at a time where we are re-envisioning and rebuilding, changing how we completely look at homelessness and the way in which we help people transition out of homelessness into a more stable environment. And, you know, part of that is self-reflection and acknowledgement that, you know, there's a lot of work to be done, a lot of experts to consult with, a lot of people to speak with, and getting your input was really, really valuable. Before you go, you mentioned 7 expectations. Was that one of the slides, or can
It
you
was not.
rattle
So
those off?
that is tied to my emergency shelter campus. Again, we're a 23-acre campus, and we, like many other shelters, first started dabbling with, well, gosh, let's put together a list of 45 rules for people that they have to follow. And at some point, you've got to make a decision as a community. And I commend you for being where you are and for being thoughtful about this, because as I said, there are a lot of different ways to provide services to people in crisis. Some of them are more morality driven, some are more research driven, and they have different outcomes. But those expectations for our campus were really balancing, gosh, if we make this so difficult to be here, then I'm going to open up a homeless shelter. Our taxpayers in the community are going to say, I thought we just put $2 million towards this. Why do I still see homeless people? And if the answer is, well, yeah, that's true, except we only said we were going to serve the homeless people who already had jobs or, you know, already had their ID or their birth certificate or any of that, then we're not really targeting the right people. So for us, those boil down to, and I'd be happy to send this to Katrina to share with you, but respect the rights, peace, and property of everybody here. You can't gamble on campus. You can't have sex on campus. You can't have drugs or alcohol on campus. But if you do, we're going to walk up to you and we're going to say, ma'am, you can't have that on campus. You can either walk off campus with it or you can pour it out and then you're welcome to come back. So it's very much based on, let's be pragmatic. Let's realize who and what we're working with and how can we work to bring them into our services instead of actively looking for how we can get them out of our services. And then the final and most important piece is we expect that each person here will work with us to the best of their ability on a housing plan. So we have a length of stay requirement in our shelter. It is 30 days, and we can extend that week by week as long as you're working on a housing plan. For some people, working on a housing plan to the best of your ability means that you are going out and looking for 5 jobs and 5 apartments and 5 of this and 5 of that each and every day. For many other people, it's, hey, you made it to the DMV to get your driver's license today, which you're going to need to sign a lease. Great job. Or, hey, you've been depressed and crippled with anxiety for 2 weeks, and today you got up and took a shower and met with me. Way to go, you're killing it. Let's see what we can do next. So it's, again, it's all about targeting. You can't provide the same exact level of service to each and every person. Just like in an emergency room, you're not providing heart attack level services to somebody with a broken arm or broken arm level services to somebody having a heart attack. So it's very much about tailoring what you need for each person.
Fantastic. Yes, I appreciate that. Your candor is appreciated and welcome, and I thank you very much for the time you've spent with us today. And I hope you will remain a contact for the county and the city of Sparks and Reno to consult with as we evolve and develop our future in this space. So I thank you very much for your time today.
Thank you so much for the opportunity, and I'll look forward to working with y'all in the future. Take care.
Thanks, John.
Okay, that was fantastic. Madam Clerk, we are up to item 7, I believe. Did we have any public comment on item 6? Madam Clerk, it looks like you are off mute, but I do not hear you. Okay, we're going to hold tight for a half a second. I want to make sure we are broadcasting and recording. And it appears like our clerk is having some technical issues. So we're going to sit on pause for just a second. I want to make sure that we are meeting all of the technology requirements. She says, I am here and we are broadcasting. I think something's happening with her speaker potentially. And She said, we just can't hear her. Madam Clerk, she's sending messages. You're typing very fast. Thank you, Ashley. Do we have any public comment on item 6? We have none on item 6. You're handling this technology like a champ. Item 7, update on regional outreach efforts underway. Madam Chair, actually, I will just take this. We'll move over whomever is giving this presentation at this time. And it looks like we're moving over a couple of folks. This is the Chiefs coming over. I saw Chief Soto is on. I don't know if there's anybody else at this time. I don't know if Chief Soto was beginning this or if there was somebody else who was leading this particular agenda item. There you are. Chief, welcome.
I think, good morning, and I actually think we have the sheriffs and Sheriff's Department and Chief Miller that we're going to give a presentation, but I don't know if I see them in here or not.
I think they're slowly moving people over.
Okay.
I know our
Well,
Madam Clerk is moving them over as we speak, so we'll just.
I will
hang
let
tight.
them give the presentation since they have all the material, but I will
There
be
they
here
are.
if you have any questions.
All right, I see a
Gonna
room
mute
full,
myself.
so I think they're up.
All right, good morning, everyone. We apologize. We were just trying to get our Zoom meeting squared away. I think we're good to go now. For the record, Oliver Miller, Deputy Chief of the Reno Police Department. Also in the room with me, I've got Deputy Chief Clint Bellamy from the Sparks Police Department, Lieutenant Maselli with the Washoe County Sheriff's Office. Behind me, Lieutenant Josh Reynolds from University Police Services. Also in attendance, we have Monica Cochran, the manager of our Housing and Neighborhood Development. We've got Sergeant Pat McNeely from the Sparks Police Department's HOPE team, and Rachel Rosensteel with Health Plan of Nevada. Say hello, everyone.
Hello.
Good morning. All right. So we are going to discuss kind of an update on our outreach over the last several months, I think 4 in total. We've been working in close concert with one another through some of the overlapping homeless issues in our region. We'll be providing you with some individual updates regarding what our agencies are doing for outreach, but I guess I'll go first and then I'll hand it over to Monica Cochran to give an update on some of our outreach efforts. Following Monica, we'll be introducing some of our personnel, and I'll be introducing Deputy Chief Clint Bellamy, who will be discussing some of his plans for outreach operations in the city of Sparks that our participating agencies, Washoe County and UNRPD, will be taking part in as well. To speak about our operations at the city of Reno, our outreach teams, Clean and Safe, in conjunction and coordination with the Sparks Police Department and Washoe County Sheriff's Office HOPE's team, and to include University Police Services, their collateral team for now, have been sharing data with one another, our boots on the ground for the past 4 months, so we can have an idea of what our homeless picture looks like. We've been in close communication with one another regarding our outreach efforts, the hotspots in town, and the timing of our operations, because obviously we want to make those coincide with the opening of the CARES campus. Last month, the city of Reno's city manager's office, CMO, coordinated a meeting with our local advocates and activists to provide them with an update on what we are doing and how we're doing it. We really gave them an opportunity to weigh in with their concerns, which was extremely helpful. We take those concerns and bring them back here for our partners in the region, Sparks, Washoe County, so they can learn what we learn, and they do the same for us. So it's been pretty effective, the open lines of communication. This week, our city manager's office will be actually meeting with the media to give them an update what the outreach is going to look like and the subsequent enforcement operations after the CARES campus opens. It goes without saying that, you know, our primary objective in the city of Reno is, and has always been, community safety and public health as top priorities when it comes to working with and outreaching to our unhoused, unsheltered communities. In terms of outreach, our daily locations are planned by our community action outreach supervisors in close coordination with our clean and safe supervisor. You guys might know him, Antonio Gilmore, who's an absolute incredible individual who works with our unhoused community along the river and other spaces inside the city of Reno. Some of our operations are generally generated through Reno Direct complaints, but for the most part right now, while we prepare for the CARES campus opening, we are focusing primarily along the river corridor in the downtown core. What we've learned in terms of outreach is that rapport building is critical in determining an individual's needs. Needs vary from location to location, from person to person, which can be altogether time consuming when we talk about the significant number of individuals that we have living along the river and other spaces in the city of Reno right now. But once that communication and trust is established, we are able to quickly work together and determine the best course of action to connect that individual with resources. And when I talk about connecting resources, it goes without saying that the reopening and reinstituting of our community court is an extremely important piece of that. We know that levying fines against our unhoused community often sets them back further than where they were before we actually try to outreach with them. Having community court come back into session and their coordinated effort to, you know, connect these individuals through community court is extremely important for us. We are working also in coordination with local partners such as Karma Box, Volunteers of America, Veterans Affairs, My Journey Home, Most Help, and our downtown Reno ambassadors. They've been boots on the ground for a long, long time now, actually helping us get service out to those individuals who are in need of it in the community. The majority of these resources are offered through communication with Monica Cochran, who's sitting right behind me, and Antonio Gilmore, who I mentioned, who is in charge of our clean and safe coordination. And of course, the Built for Zero initiatives and the weekly meetings that spin off of that. What I'd like to do now is introduce Monica Cochran, who's going to give a little bit of a deeper dive into some of the backside services that we often don't talk about that are provided to this community. So Monica, if you would.
Good morning, Monica Cochran for the record. My role really with outreach is more coordination and just trying to keep a real just easy line of communication between all of the providers. And part of that, I am on the Built for Zero core team and the Built for Zero outreach committee and the clean and safe team. So sitting on all of those groups, I talk to a lot of individuals from different organizations and kind of have communication with them to try to pull together resources to get organizations out, in front of any kind of cleanup efforts. It's all about offering services, getting folks out there. The goal of this extensive outreach is really to help folks staying in public places, mitigate any of the barriers that might be stopping them from transitioning to more permanent, safe housing. And for a lot of years, there's been a lot of great groups out independently providing services. And now, probably for about the last year since the Built for Zero initiative got up and going, all of these people are in rooms talking together. We've had countless conversations that have really helped make these efforts a lot more cohesive. What we heard on a lot of those groups is, it was like a cactus just growing arms. People were out providing services, but maybe one group didn't know what the other one had to offer, and likewise. So with what I do for the outreach coordination really just involves frequent communication with the boots on the ground staff. Some of the groups that Chief just mentioned. And what those folks are doing is really trying to help people navigate the path to housing. It could be countless efforts of talking to one individual before they accept any kind of resource or service. And some of the groups that I frequently communicate with are basically VOA, VA, the Karma Box, the Most Team Bid Ambassadors, Northern Nevada Hopes, Eddie House, Health Plan of Northern Nevada, Foundation for Nevada, sorry, Rachel, Foundation for Recovery, and so many more. So it's just, my effort really is in a cohesive, pulling them all together so everybody's on the same page of when they should go out, who they should be talking to, linking one of them to another. I mean, just through a lot of these conversations that we have constantly, I think the real benefit is each individual from the different organizations knowing what other ones have to offer and really helping link people to resources. Some of the resources that are offered by these groups, some of them can directly house someone. Some can offer helping them get medical care or substance abuse, insurance, Medicaid, navigating through the SDI or SSI process. A bus pass, getting them in touch with their family if they're stranded here. There's so many different groups involved in this larger collaboration that there's kind of something for everyone, I guess. And everyone is unique and everyone's position is different. And, it seems it's so much more collaborative now that, it's not one group going out and maybe they only offer mental health and that particular individual, that's not their barrier. So now there's such a larger effort and kind of being able to touch on every different thing that might be hindering that individual from accepting some sort of resource that will help them navigate to permanent housing. That is the end goal. And sometimes it takes a bit to get them there. So that's kind of my role in this outreach efforts.
Thank you for that, Monica. And she's absolutely correct. We could not do what we do without her coordinated effort in ensuring that these individuals are absolutely receiving those resources that are available, keeping them organized for us. And next, I'd like to introduce Deputy Chief Clint Bellamy of the Sparks Police Department. He's going to give an overview of his outreach operations and what his staff is doing.
Good morning, Deputy Chief Clint Bellamy for the record. As Deputy Chief Oliver Miller mentioned, currently the Sparks Police Hope Team and the Reno Police Department, we're exchanging information like we mentioned the last time we spoke to CHAB. We're exchanging statistics about our outreach and what is done. It's actually been sort of a dry rehearsal, and we've found tremendous success up to this point, so that once we do the outreach operation related to the CARES campus opening, I think we're going to experience success. I think if we hadn't, for lack of a better term, joined forces and began sharing this information and this constant communication, I don't think we'd be successful with this upcoming mission. Period. Up to this point, actually since July of 2020, the Sparks Police Department Hope Team has offered outreach to over 1,250 people. The Hope Team averages about 40 outreach contacts per week. Inside of those outreach contacts, Sergeant McNeely may be able to speak to it specifically, but we have quite a few success stories. And I think those are most important because it tells us that our outreach is obviously successful. And one of the terms that that I recently learned that Rachel will talk about, same thing with Sergeant McNeely, is the outreach approach that we do use is a person-centered approach. And I know Deputy Chief Miller mentioned that person-centered approach is going to take time because we understand that these individuals have different backstories. So to peel back those layers, and if you're truly trying to offer help and change a person's direction, it's going to take time. It's not a blanketed approach, because if you throw that blanket, you're going to have the same issues begin to resurface over and over and over. So person-centered approach, Rachel will speak additionally about that with her presentation. But when we talk about our outreach, we're talking about offering the assistance in obtaining identification, birth certificates, providing transportation to care facilities. This is done on a routine basis with our team. The areas on the river that we're focusing on currently, when we recently went down there, we broke it up into individual zones. But what we found is that there's certain zones that other jurisdictions are adjacent to the Sparks Police Department, our jurisdiction, which would be Washoe County, and UNR Police Services. So we reached out to both of those individual agencies, and we have been working in conjunction with them to identify those areas. And again, reaching out, providing outreach for this future outreach operation. Since then, the Washoe County Sheriff's Office has formed their own HOPE team, and they're going to use the same guidelines that we use at Sparks PD. UNR Police Services has also given us 2 UNR police officers to assist in our outreach program, or our HOPE team. At this point, I'd like to pass it over to Sergeant McNeely. If you could provide some more insight on our outreach.
Sergeant McNeely for the record. The HOPE team, currently we have 2 officers from the Sparks Police Department. As Deputy Chief indicated, we're starting to work with UNR. They've been working with us about 2 days a week in certain areas of the river. It's just across the river that UNR Farms exists, and any effort they make over there, of course, affects the Sparks side of the river, because people, if they do choose to move, which they do sometimes just during outreach, they'll come into Sparks. So it's good for us to work with them and train them how we actually do our outreach, which, just for the record, it takes time. And so with the CARES campus opening, our strategic plan is that it's going to take several months to actually get people off the river and into the campus, so that whatever hard date that the opening is, we're not counting on that date being the date that everybody's just going to go to this campus. A lot of them won't. So our approach is slow. It takes time. We, as police officers, go out and find the individuals and then connect them to the services. So with UNR, they've been out there. It's been great. We've met new people that we've never talked to before, and got them signed up for Medicaid with Rachel, and starting that process before this campus opens. And so we're also educating everybody out there about the fact that the campus is opening. Sorry, I should have taken off my mask. That's part of our outreach, is to let them know that this campus is opening and what it's going to offer. A lot of what we do is connect those individuals with the resources that we have, and Rachel will talk about that in just a little bit. The approach that we do take is trauma informed. So when we first meet individuals, we go in with the knowledge that there is trauma in their past. There's a reason why they're homeless. And so that's where we start, break down barriers, and then we're able to actually communicate with them and connect them to people. And they're more willing to talk to us, reach out to us, and things of that nature. And with that, I will introduce Lieutenant Joshua Schneider from UNRPD and the recent efforts they've made.
Lieutenant Josh Reynolds with UNRPD for the record. Thank you for having me. As has been alluded to already, The reason UNR wanted to be involved in this collaborative effort is that we do have jurisdiction with a close proximity to the other agencies, specifically the Sparks Farm, Wolfpack Meats, which is right along the river there. So this is fairly new to UNR, University Police Services, as far as the homeless outreach piece. With that being said, we assigned 2 officers to essentially work full-time for the outreach piece. They've been working with the Sparks Hope team and Rachel, and that's been a very productive collaboration thus far. And I just wanted to highlight some of the production that's been made thus far at near the Sparks Farm. We're working on getting a mobile medical team out there to provide Medicaid outreach, which they can assess medical needs, coordinate referrals to specialists, coordinate with RN case managers, and help stabilize medical conditions. Medical insurance signups were made available, and several unsheltered signed up for Health Plan of Nevada through Rachel. Cell phones were ordered and actually provided to some of the unsheltered population so they could use those to make medical appointments. One person was provided with same-day housing opportunity but declined. And actually, they're going to meet with him this morning. He's finally made the decision that he is ready to move to housing, so they're going to assist him with that today. He's been out there for several years. Coordination with individuals to get Nevada ID cards so they can apply for work. Assistance has been provided to order birth certificates and social security cards for those who need them. And also blankets, clothing, food, pet food, various other community resources have been provided to anybody who's requested those. With that, I'll introduce Lieutenant Maselli so he can provide an update for Washoe County.
Thank you, Josh. Good morning, Madam Chair and Board. For the record, Lieutenant Anthony Maselli with the Washoe County Sheriff's Office. As Deputy Chief, we go the opposite way. Deputy Chief Bellamy indicated, the Sheriff's Office has recently selected and formed our outreach team. It's going to consist of it already consists of a sergeant and 2 deputies who will be a full-time unit, a full-time team beginning July of this year. And I want to actually thank right now Dana Searcy and Rachel Rosensteel for assisting us with the selection of our team. I think it's super critical to have them involved in the selection, as our team will be working very closely with them and with all of our outreach partners. So it was very imperative to us that they were involved in that process. So I thank you for that. And thank you, Dana. Revolving around our team selection right now, we are going to be implementing several different training courses for our team to include the trauma-informed care, the person-centered care, which our team working very closely with the Sparks Police Department Hope team. Our team has only been around for a week right now. And in that week, we've already gone out on 2 different outreach efforts, and Rachel can speak closely with those, as she was involved with those too. And those 2 areas being the end of world, and we also collaborated with BLM, as I'm sure many of you are aware, from the federal level, several areas in our community we're going to be closed from BLM. So what we did is we collaborated with them and we provided outreach to people camping on the BLM lands. And Rachel and our team went out there and made several successful contacts and offered a lot of outreach efforts that I think was very successful. And then, of course, we're continuing with the outreach at End of World. We started with that. We have several success stories out of there as well. So with that, I would just like to conclude that in collaborating with all the agencies here, as well as BLM, because of the unincorporated areas that we see here in the the county that we have to address. That's why we brought in BLM. It was very important to collaborate with all of us together and offer those outreach efforts and resources to everybody within our community. So with that, I would just like to turn it over to Rachel Rosensteel with Health Plan of Nevada, who can update the board on the outreach efforts and what she is in charge of.
Rachel Rosensteel for the record. So we've been doing, Health Plan of Nevada has been doing outreach with the various jurisdictions here, specifically with Washoe County, UNR, and the Sparks Hope Team. So when we go out, we are providing the initial assessments with the individuals that we encounter. So like DC Bellamy mentioned, we're utilizing a person-centered approach. So every person is different. Not everyone needs mental health services, right? So some people are out here and they need medical assistance. Some people just need social assistance. So I come out and you know, really get to know these people and identify what their needs are, because it's not always it's not about what we think they need, it's about what they truly need. So based on what it is that they need, we're bringing out social workers, mental health providers, doctors in some cases, paramedics who provide ongoing case management. We're bringing out public health workers, doctorate students, community health workers. We have a large team of people who are coming out and providing ongoing case management to individuals experiencing homelessness. And we are connecting them to housing, medical care, behavioral health care, and social services, and just breaking down the barriers and helping them navigate through the healthcare system and the social service system. So we're also helping bridge the gaps within the community and in some cases in the criminal justice system. So if in any cases people are in the jail, we're helping, you know, where you can come here and meet with them, you know, in the detention center, and then figure out how we can help them navigate through any legal issues that they may be having. And I think that it's been really great that the law enforcement agencies have been so receptive to working with this population, and our officers have just been so compassionate and understanding. And like Lieutenant Maselli said, or someone said it, there is not, or maybe he said it, but there's just no, you can't take a blanketed approach. It can take time working with these individuals, and it's really important to build that trust. And they want to see that we're going to do what we say we're going to do, and we're going to follow through with services. So we do have a case management system. So we're tracking these individuals to make sure that we're following up with them, and all of the contacts that they're making. We're going back to see them, and you know, we're not over promising and under delivering. I think that's really important. And then we're just ensuring that whatever the individuals state that they need, we're making sure that we're getting them that, and following through with the connecting of services.
All right, thank you for that, Rachel. You know, one of the things that I forgot to actually discuss with you was all of the contacts. It seems that since we have been working collaboratively in partnership since last January, last December, I think that the number of contacts that our individual agencies have made have increased exponentially because we are sharing information. I'll give you just an example. Since last January, the Reno Police Department has had more than 1,000 contacts with individuals experiencing homelessness. And we're able to have an impact on getting those individuals services. I think just last week, we got an update that our agency had 263 contacts with individuals along the river corridor, and beginning to have those discussions and, you know, communicating with one another where the overlap is or where we can do better. The exchange of ideas has really helped us to be successful in delivering those outreach services. You know, this is all going towards when we are able to have our CARES campus open, and when we are able to have a place where individuals can actually go. You know, I've gotten some feedback from some of my police officers, boots on the ground, and they've told me, yeah, we've got folks that are ready to go there right now. We just have to get it open. So with that said, we appreciate you giving us the opportunity, this body, giving us the opportunity to let us talk about what we're doing in terms of outreach. We'd like to open it up for questions from the group.
Thank you very much. And thank you all for joining us here this morning. I think it's great to see everybody together. I suppose physically as well. That means we're getting towards the end, folks. So there's a light at the end of the tunnel of this pandemic, but also to see all the different jurisdictions and the different agencies coming together to collaborate and share information so that we can do a better job in this space as we move forward. That's only going to happen by doing exactly what you're doing. So thank you all for your compassion and your empathy and your work with these individuals. I appreciate that. Members, if you have questions or comments, Member Hill and then Mary Lawson.
Thank you. And thank you for the presentation. Are we using the data collection software that the city of Reno or the Washoe County uses when we have make contact with these folks?
Sorry, Monica Cochran for the record. Are you speaking to the HMIS system or the Good Grid system? Are those the systems?
Yes, either one of those systems when the police make contact with these folks.
I can't speak for the police side, but in certain outreach efforts, the groups that are enrolled, just say in HMIS, they do enter the individual's data into HMIS. But they have to be enrolled in that system. And I don't think you need to speak to your side, sorry.
Yeah, I can speak to that. We are not using the Good Grid system right now or the other system that Monica was talking about. We have an Excel document that we're keeping online and tracking all of our personnel with. We have looked at the possibility of emulating the system that Sparks PD has, but our IT folk are in close communication with their IT folk, and we're looking at getting there. And that's been one of our goals, to gather data consistently over the last 4 months. So we have to really pull out what we need and compare what they have to what we have so that we can see if we have any overlap in services with individuals. And it'll help iron out the issues when we are able to become more consistent in what we are measuring. That answers your question, ma'am.
Yes, it does. It does. Thank you. And I think our board has been hearing from really concerned community members that want to see more caseworkers doing this work. And I think a lot of it is, you know, is there a fear of, you know, past contacts with police, but also, you know, are we collecting the data we need and, you know, doing that sort of casework outreach that we need to be doing, and knowing that the police, many times your role is not to collect the data and follow up. And so I just asked that for the board to think about, you know, what are the options that we have to ensure that we're all working from the same system. And I think it's great that you've had over 1,000 contacts, but you know, what does that translate to? You know, one person being housed. So how do we collect the data in a better way to measure the successes?
Thank you, Member Hill, for mentioning that, because that's exactly where my mind went, particularly as the Nevada Cares campus comes online and the Safe Camp. how are we following through on that great work that you all are doing to find out what the end result is? If, you know, is John just moving from one jurisdiction to the other, or is John actually getting to the campus and getting services and then following John all the way? I'm just using John, obviously, as a hypothetical, following through to permanent housing. So without that information, we just don't know if we're just moving the issue around or if we're actually resolving with some examples that you gave, which are fantastic. But there needs to be a better data collection point that we can all point to and track here with this body. So Mayor Lawson.
That was exactly where I was going. I think we got to have a centralized database because, you know, we're John, as Naoma's example, John moved from Washoe County to Sparks to Reno. There's no use reinventing the wheel 3 times. It's take his information down, figure out where he's going. Then the next officers who have contact with them on the HOPE approach, then they can say, hey, how are you doing? You're supposed to get transitional housing yesterday. You know, all that information is at a fingertip. So I think that is ultimately the most important part of this is we're all on the same page and we all have the same information. I do appreciate the coordination with UNR and Sparks. I think that's an awesome idea to so that we're all once again rowing in the same direction. I'm impressed with where we've come from and where we are today. So thank all of you for your hard work. And I'm going to agree with Alexis that, you know, caseworkers are all important for this approach and to follow through the system. I think that's how we're going to make the success at the end of the day. So thank you guys for everything you do.
Thank you very much. We're going to go to Member Dare, then Member Delgado.
Yes, thank you. One of the things I think it kind of seals the deal on this is the warm handoffs, because it sounds like you guys are communicating with each other on people. It sounds like you mentioned that. And so obviously that's important, but that's where the data is important. But also, I think it'd be really good for us to see and hear what are the next steps that you guys see that you guys are looking at. And because I really do think with you guys on the front lines, and I really do love that you guys are doing what you're doing with collaboration and everything, is that we know what are you seeing? What are some of the best as we move into all these plans? I think you guys have a perspective that we couldn't even have because you're down there every day working with these individuals, and so would very much love to hear more. But I think next steps is one of the questions I just want to hear. What can we expect? I love where we've come. Obviously, it takes time to move forward. What are some of the new goals that you want to see in the next month or so?
Well, for the city of Reno, in terms of law enforcement, you know, while we are conducting these outreach operations, which may or may not lead to some enforcement operations, sustaining that is going to be the difficult part, right? So maintaining those close relationships with our downtown ambassadors and our downtown enforcement team officers and the staffing that it's going to take to keep that going is going to be the trick for us. Also, you know, at our disposal, you know, we are taking a deep dive into some of the laws that apply to homelessness. Right now, we've got 2 primary RMCs on the books that we're taking a close look at, and we're looking at what other jurisdictions are doing to see if they still stand the test of time and are applicable now, you know, to what we need in terms of outreach and enforcement. So a deep dive into the rules and laws that surround this issue, and really, you know, getting with our regional partners to see if we can come up with some consistency with that as well for us.
I think for the Sparks Police Department, knowing that we're limited on our resources and the amount of personnel we would have for our Sparks Hope team, we've taken some steps with internal instruction with our patrol officers. Our Hope team has done in-person briefing training so that they're up to date on the specific laws, and we want our patrol officers to have the same approach that our HOPE team would have when they interact with anyone experiencing homelessness, so that we would have the same exact success that they would have if they're interacting with our HOPE officers, because we don't have the amount of people to actually make an impact at all times. They'll be good with Washoe County and UNR, but if everyone in the department isn't speaking the exact same language, and if we're not speaking the same language regionally, we're going to be repeating the same steps over and over. It's going to reduce our efficiency. So that's what we're doing internally. The software that's upcoming is going to help, obviously, but that person-to-person individualized approach is where we're going to make our most money.
Lieutenant Maselli, for the record, excuse me. As far as the sheriff's office, I would like to mimic what Deputy Chief Bellamy was saying, in that we will be working closely with them and with our other regional partners to ensure that we are all speaking the same language. We are all doing the same thing. We're not duplicating efforts, but most importantly, that we are following up and following through with all of our contacts and all of our outreach. Getting our unit, since we are brand new, getting them involved in specific training, but also looking at different programs like what John presented earlier that have been successful in other areas, and what can we bring here that maybe will help our community be very successful and our units be successful in all of this.
I think that Chief Jason Soto had something to say about this. Chief, I don't know if you're on and can chime in.
Yeah, no, thank you. Can you hear me?
Yes.
Thank you. Thank you, Councilwoman Jordan. I actually appreciate all of this input in terms of being on the same page. And I want to talk about some of the challenges that I think the city of Reno has faced, because we have been faced with this probably about 7-8 years almost now. But when you're talking about 4,000 separate contacts, the when, the where, and the how we collect this information is important. We've had several lawsuits that have come across our desk because of certain information that we have to understand and maintain and remember, that when it comes to certain things like HIPAA violations, we have to keep that in the back of our head in terms of how we're collecting this information. I love the fact that we're all starting to share this information across jurisdictions. I think it's very important that Reno, Sparks, Washoe County, and the university are all on the same page. I just want to make sure that when we do that, that we don't fall into some of the same types of lawsuits or challenges from some of our advocate groups, such as the ACLU, as we have in the past. So I just want everybody to remember that piece, because that's a very important piece of this moving forward.
Thank you very much for that, Chief. I think those are details that, as you all collaborate on what this data collection and sharing model might look like, will have to obviously be taken into consideration to make sure we're not doing something we didn't intend out of very good intent. So yeah. I hear what you're saying, and I think that is something that, as this evolves, we will definitely want to be sensitive to, while at the same time being effective in our approach and addressing of these issues, which is something that I mean, the fact that this board came together jurisdictionally, where traditionally it didn't in the past, I think was a huge first step to come together to collaboratively acquire 15 acres to help us address these issues, and to now be even stepping back further and evaluating programs, approaches, effectiveness, not effectiveness, is a real opportunity for us to take a sobering look at the things we've been doing, not been doing, what we've been doing right, and what have we not been doing right, and how can we build a new model, which is, I think, an opportunity that we're only going to get once. And I appreciate you all coming together, sitting in the same room, and collaborating to see how we can best do this in the most compassionate and effective way. So I thank you all. Member Delgado, Chief, did I cut you off? Did you have anything else?
No, I just wanted to say that the communication between Sparks, Reno, Washoe County, and schools really is unprecedented in terms of the amount of time that I've been in this role. And also with all of these groups, we can't forget our advocate groups. I know that a month ago, we met with the ACLU, our faith-based leaders, our churches. We have to bring our community in to become a part of this solution. It can't be all driven by law enforcement. It can't all be driven by social services. It can't, there's just so many arms of this, which is the great thing about this CARES campus and the wraparound services. And I want to make sure that we remember to focus in on all of those, because we've tried to do it ourselves and it didn't work. So this new approach and the collaboration that we've gotten has been nothing short of very, very satisfying. I just wanted to get that out there. Thank you.
Thank you, Chief. Member Delgado.
Thank you, Madam Chair. Just again, I think everyone's great. Everyone's patting each other on the back. I think it's great that we got to continue the work. And I want to also thank HPN for being at the table. I don't know which other MCOs are also involved in terms of their outreach as engaged as HPN, but hopefully if they're listening, that they also are engaged in terms of that conversation. And just wanted to go back to, I believe it was Deputy Chief Miller, and just wanted to revisit, you said one of the reasons we're not doing the good credit or the HMIS data sharing is due to what again?
We're trying to get together. We've been working on it for the past several months, council member, trying to really move away from the system that we've got right now. Each one of our police officers carries a mobile device with them. Inside that mobile device, we have an Excel document, so to speak, that we collect our information on. That information is automatically transferred to Mr. Gilmore, our Clean and Safe coordinator, and he's able to plug that data in and get that data over to Monica Cochran. Right now, we're looking at the potential of transferring over to these other systems that are being utilized by our regional partners so that we can speak the same language, for lack of a better term. We've been evaluating it. I know that our boots on the ground have been working in close coordination with Sparks Police Department, Washoe County Sheriff's Office, and University Police Services to see what and how they do it, to see if it's something that we could bring into the fold. Because I think it was Councilwoman Hill that actually brought it up earlier. You know, it is taking us a little bit longer to get our data and to sync it and to work our way through for some of those backside resources that we need to utilize to get our unhoused population connected in with the resources that she's got. So it takes a little bit longer. It's a little bit more cumbersome, but you know, we are getting there.
Gotcha.
There is a cost associated. Sorry, sir.
It's a bandwidth resource piece through what our RPD is currently kind of working through. Wasn't sure if that was part of the budget conversation as we start to roll in terms of how we're trying to better serve or get some efficiencies on our side at the City of Reno. I didn't see that position necessarily brought forward to us in terms of how we can better serve or support you guys in terms of data or IT support. But I just wanted to kind of figure out where are some of the voids in terms of filling the status quo in terms of what was presented. Thank you, Deputy Chief.
Councilman Delgado, I can answer that a little bit more clear too, because I've had some conversations with City Manager Thornley about how we can be more efficient in terms of how we deal with our unsheltered population. So in the past, it really truly has come down to numbers. When you're talking about several thousand contacts, it is a lot of work. It is a big lift. So we have been looking at a few positions, or he has been looking at a position or two that would help assist us with that, even on this current budget. Just talking about how we can make it work, understanding that all positions are at a premium right now, and we know that they're difficult to get. But even if we can't get there, maybe resourcing something here at the department that is more specific towards the collection of that data. maybe even another type of data individual that could collect the homeless piece. So it has been discussed, and we are certainly looking at it, and we understand that that's a priority for our council, and we'll certainly keep you appraised on that.
Thank you.
Thank you very much. Member Lawson.
And just so you know, and I think Deputy Chief Bellamy knows this, but you guys find a technology solution that makes your job easier, we'll find the money. I'll find the money. We'll make it happen, because obviously technology is what's going to save the day here. And so I'm just telling you, you find something out of this, you know, we got CARES Act money right now that we've got to spend. This fits perfectly in it with the homeless shelter. So this we'll find the money to make whatever happens you need to make happen. So just keep that in the back of your mind.
Thank you, Mr. Mayor.
Thank you very much. And obviously I'm not the mayor, can't speak for the whole council, but I would certainly echo those sentiments that the data collection piece is huge. It's just enormous. And I think Reno would be in the same position to say, you know, let's figure that out. It's so critical that we get that now. And it's built into the information that the Built for Zero and that the county is collecting, because it all ties together. And we as this board have been so hyper-focused on the data, which is important. It's difficult to solve things when you don't know what those things fully are. And so your touch points as our faces out there in the community is so important, that we get the correct information put into the system so we can ensure we are getting the outcomes in which we have all spent a lot of effort and money towards improving. So we'll get there. So thank you all again very much for being here today. Continue to do the great work that you're doing and leading with empathy and compassion with this population. I have to say, I think the thing, aside from seeing you all together and working together on this issue, was the discussions on training with trauma-informed care and the person-centered care, and that training trickling to all individuals in the departments. That's a huge thing for this population, and I think our presenter here today spoke to that how important that is. So thank you all for all that you're doing. I see Mr. Thornley popped on. Did you have some comments on this, City Manager Thornley, or were you going to speak on the next item?
I'm just next.
Okay. All right. Thank you all. Thank you all for the great work you do.
Thank you. Thank you. Thank you.
All right. We're going to move on to item 8. City Manager Thornley.
Well, good morning, Madam Chair, members of the board. I'm Doug Thornley, the City Manager over here in Reno, and I have a very brief update for you all this morning on the CARES campus. It's been a subject of much discussion this morning, and I'll share my screen here and we'll let you know where we are at. So we've been talking a lot about what the anticipated opening date of the campus is, and I'm pleased to say that through just a Herculean effort by Community Development Director Stockham and Building Official Pingree and our regional partners, we are closer than we've ever been. And so on or about April 15th, we anticipate that the building perimeter and the courtyard will be ready for transition. And so what that means is our partner VOA will start the work that it will take to make the completed structure usable as a shelter for our region. And so from the 15th to the 21st, we anticipate that the VOA will be moving beds and moving the things they need to complete the transition and intake of our guests at the CAC and the 4th Street temporary shelter the next week, which is the 22nd to the 29th. And while, of course, we will not turn away new clients during that time, that is effectively a soft opening. And the anticipated opening date for the general public is April 30th. The reason that it's a soft opening. The reason that these dates have slipped just a little bit is that the restrooms, the showers, the lockers, all those things that make the CARES campus a habitable alternative to some of our other facilities now, where the delivery of those things were impacted by winter storms in the Southwest. And so while we've got the foundation in place for swift installation, once they get here, they're not quite here yet. And I know you can all appreciate that there are just a lot of moving pieces to operating and opening a new facility. And so we're working hard with VOA. We're making sure that in our pandemic condition, we're safe when we move all of the beds and that no one goes without a bed in that time. And of course, through Clean and Safe, we've continued outreach to myriad constituencies in this interim period, and we'll continue that effort even as the campus opens. So it's a tremendous amount of work, and we've knocked it out in I don't know that there's necessarily a record for the time in which we've gotten this thing built, but it is a huge lift, and we're looking forward to an official opening later this month. You can see here on the slide, the meal providers will continue even once open. The Gospel Mission handles breakfast. Catholic Charities provides a hot lunch and then dinner to our guests and some of our unsheltered community here on the site. This is a rough approximation of the schedule that I just laid out for you with a couple of other details. And so when you look at about a 3.5 month effort in terms of construction, we're looking at access road work here the end of this week. And then we get into that schedule that I laid out for you before. And so just in general, the blue is activity at the CARES campus, gold is move-in dates, and then of course down here, the second from the bottom with the red outline is the anticipated opening date of the campus itself. And so while in this calendar here, we continue to work with the contractor on possible additional items, and we're working through that through the lens of the remaining budget. The next steps, of course, we've talked a bunch on and off about phase 2 and phase 3. So phase 1 is what we were talking about on the previous slide. That's getting the broad, large dormitory open, getting VOA transitioned in there, getting our guests at the temporary shelter on 4th Street and the CAC transitioned over there in a safe manner, and working out all the surprises that the operation of a new facility always brings. We're also looking at the establishment of a safe camp in the Governor's Bowl, and you're going to hear about that from Assistant County Manager Kate Thomas in just a few minutes. And we are working towards transitioning the operation of regional shelters from the city of Reno to Washoe County, and County Manager Brown will be speaking about that on agenda item 10. Phase 2, where we talk about the safe camp and the some of the amenities of the campus, the storage facilities, the cafeteria, the kitchen. Those things are of course dependent on design of the program, and we heard that this morning from Mr. DeCarmen. The phase 3 transitional housing with the Reno Housing Authority on that parcel to the west that was carved off, of course, is again incredibly important to the success of this campus too. And so the independent fundraising initiatives that go along with those are, the importance of those cannot be understated. But in terms of actually designing those programs, I think we want to make sure that we're putting the horse before the cart, and we've got that squared away before we go out and really promise what those facilities are going to look like. So that's the really quick update to what's going on there at the CARES campus. I am happy to get out of this and answer any questions you might have.
Thank you very much, City Manager Thornley, and we'll get back to the screen with everybody on it.
I am trying real hard to do that.
Well, okay, there we are.
Thank
There
you
go.
much.
There you go.
You're covered.
Very good. Okay, members, questions. I see Member Dare took his speaker off, and then we'll go to Member Hill.
We got to go down and tour it, and I just do want to say how amazing, how quickly it all came together, and it's looking amazing. One of my things that I would love to have a little bit of thought around is the maintenance of this now that it's going to be in place, the finance maintenance, what it's going to take to clean and put together. I don't know if that's part of the equation and conversation yet in staffing, but obviously that's one of the pieces we have to look at. So when I was there, after I walked out, I thought, how awesome. And then I thought, oh my gosh, this is monstrous. And it's going to take quite a feat to continue all the things we're looking at, which is great. And we'll get there. But just wanted to see if we had any updates on those kind of numbers or thoughts.
Well, I think it's difficult, of course, to project exactly what those numbers are going to be because it's a new facility. But you are right; it's a large campus and it's a large building, and the maintenance and care of the facility will be an issue. As we stand right now, VOA is our current operator for both the CAC and the temporary shelters on 4th Street. They'll transition over under the same agreement that they have in place right now, and they will carry with them the same obligations in terms of cleaning and things of that nature. As we move forward into permanent operations and the operations of the campus itself as a broader ecosystem take place, I'm sure we'll be making adjustments. But in the short term, I don't have a hard number for you, Councilman Dare, but it is an issue that's top of mind for everyone who's involved.
I mean, part of it, I just think of the VOA, I know like the showers they have now compared to how many showers they're going to have. And under the same contract, we're expecting them to go from here to here, which is quite large. And so things to think about. I mean, I know there's a lot of moving parts to this, so none of this is to say we should have every piece, but we just got to keep looking at it. But I'm a little concerned that we are taking them from that setting to this setting with the staff that is used to doing this setting. So I'm sure, I know the professionals, they'll figure out what they need to do, but I know I'm definitely look forward to seeing that plan.
Thank you very much. Member Hill.
This is a really minor detailed question, but I have been hearing complaints about the bedding that is at the VOA and the current location. Are we moving that same bedding to the new shelter, or are we buying new bedding with the CARES funding?
New bedding is being installed in the facility. Like I said, it's incumbent on us to make sure that we get all those beds in place. We get them in place in a manner that is safe and consistent with our existing pandemic protocols, and that nobody goes without a bed in the meantime. So we have to have the new permanent shelter set up before we can start transitioning folks from the temporary and the CAC. And so that's the short answer to the minor detail.
Thank you. Thank you very much. And I appreciate all of staff and Arlo and Kate and everybody's participation in all of the tours that you've been giving. I've been on 2, and just the dramatic change on the campus in just a week's period was pretty monumental. And the speed at which Mr. Pingree and Q&D are moving this project along is really just kind of incredible to see how quickly they are doing just amazing work on a facility that really does have, great heat and air and ventilation and lighting, and the idea that there are these sort of walls, interior walls, that as it evolves can be adjusted and moved to better suit the needs. And I know there are many, many details that still need to be worked out. And the understanding that when this opening occurs, that it is, there is still a tremendous amount of work to do, and it's not all going to be all finished, and it's not all going to be pretty and shiny and all the services aren't going to be all perfectly in place to begin with, but the facility itself, just kudos to everybody in the 70 or whatever workers per day that have been just churning and burning to get this up and going as quickly as possible to serve our houseless neighbors. So thank you, Doug, and your leadership on this, and Mr. Kreutz, and everybody at the county for making this a priority in our region. And as it evolves, it's going to be pretty tremendous. So thank you for that. I don't know if we have, and we're going to continue to do tours. I know there are a number of advocacy groups and individuals that want to see the property and kind of, wrap your head around kind of all the things it can be, because that to me is the most beautiful part. And all the things that it is in the short term, it is definitely lacking warmth. Not in the sense of heat warmth, but in the sense of it's all pretty beige, and it needs some art, and it needs some color, and it needs some trees, and it needs some grass. And I know those things will be coming, and there's some opportunities there for our community to participate in evolving this campus, which is pretty exciting. Okay, Madam Clerk, do we have any public comment on this item?
Madam Chair, you have no public comment on this item.
Okay, we are going to transition into item 8. Kay Thomas, thank you for joining us.
Hi, thank you for having me. So I am happy to piggyback on the previous conversation around the CARES campus. I have a few slides to dive into the piece on safe camping. Before I do that, I wanted a quick mention to the earlier discussion on data. Built for Zero, the team will be finding this out, but Dana and her team have been doing a great job, and she informed me that we're in the process of developing an outreach app. So that'll be in compliance with HIPAA and data privacy. No more databases, right? I mean, it'll tie into HMIS. Thank you for the thumbs up. Kudos go to Dana, not me. I'm just the messenger. But we want everybody to participate, of course, so that it works for you. If you have questions, reach out to Dana. She's going to kill me, but go for it. And we just want to make sure that it works for everybody. It's in testing, but I think there's room for edits. So I will jump into my presentation really quickly here, if I can do as good of a job as Doug. Okay, hoping you guys can see my screen.
We cannot.
Oh, all right.
I can hear you. I cannot see your screen.
Yeah. Let's see here. Oh, I have to click share, actually.
There you go. Now we can see you and hear you.
All right, so there we go. Okay, so real quickly, I'm going to try to beat Doug in timing, but we'll see. We have an update that some of the folks that are on this meeting had seen as far as the Built for Zero presentation was concerned, but wanted to quickly go over, as you are all well aware, the current community conditions around the need to provide a safer place for folks that are camping on the river due to environmental concerns, which we as a group have heard previously from Tumwa, obviously public safety concerns, public health, and public space enjoyment. I was happy to hear from John DeCarmine about their successes. Our model obviously takes into consideration a lot of those issues and successes, because we have done a good job of reaching out to successful safe camps. I know it's been a push. We want to get this thing open. I will say thoughtful isn't always fast, but our motto is also to look at ending homelessness and not just managing it. So we're all moving in the same direction. I'm happy to hear all of the momentum that's been happening today. So you see some of those solutions here. These are some of the places that we looked at. Again, we go back to the issues in the right: housing focus, low barrier, small in size. You know, when we last spoke as a group, we were going to put a couple hundred people in the bowl. We have learned that is a recipe for disaster. So we've retooled and we've put in place a structure that we feel will be really successful. I think that housing focus element helps to move individuals from the location into housing as quickly as possible. The staffing has to complement those actions. And so that you're not just seeing the 50 people kind of stagnantly staying there, that we're seeing people moving through the process. So we're talking about the Governor's Bowl. We're talking about the site. We have hit some snafus moving forward, though. We want to make sure that, and I'm going to be talking briefly about two models. There's two scenarios. The first is the near-term solution, which is the temporary site you see there in green. In going into that temporary site, which is supposed to get us up until winter, we're going to be working in parallel on a longer-term camp that needs some infrastructure. So inside that bowl, we look at it and we go, oh my gosh, it's ready. It's got electricity, we've got lights, we've got all the things there. Turns out that's not the case. So in order to get infrastructure into that bowl, it's going to take a number of months. So the temporary site is where we're at to get services in place to get folks into a safer environment, and then we can start working on that longer term site in the middle of the bowl. So we're working with the Karma Box project because we know time is of the essence. That's the group that's individually reaching out to the folks on the river, forging those relationships, letting them know this resource is coming. And so we're going to, in the near term, work with them. When we go into the longer term camp, you'll see an RFP come out. So we'll reach farther into the resources out there to see who wants to come forward, and just, we're in less of an emergency situation at that point. We'll go through the RFP process as we should. So that's what you're seeing here. We go back to the single most important element of a program, and that's the housing focus. If we're going to be successful, that has to be the way that we think. And so the services that we're looking to put into the program include the restrooms, the public safety elements or public health elements that you heard John DeCarmine talking about, trash service, and evening meal, which will be provided by some community supporters. The staffing ratios I mentioned are very important. So we've got a full-time county staff person that'll be assigned to the Safe Camp. We have the contracted operator that I spoke of. Obviously, case management is crucial to the success of this, as well as security. And the security will be such that it's not as much of a law enforcement presence. It's just a kind of an ambassador approach. We've seen some successes with the security at the Our Place campus, which for those of you who have visited, it's sort of, they're part of that community, helping keep everybody safe. It's not a heavy-handed law enforcement presence. Obviously, to our law enforcement partners that are watching, we're hoping to drive way down the need for calls at the location, but it will be low barriers. So we know that there could be issues. We want to meet people where they're at. There are going to be some rules. We heard from the Safe Camp earlier in Florida that they aren't going to have rules. We think we can pull that off. We think that participant responsibilities are going to help foster ownership. Obviously, we won't do that to people in crisis, but I think there's a role. We'll see if it works. What we think there's a role for folks being engaged in helping to upkeep the place that they are. We've seen those successes too with what Karma Box is doing in creating that idealism on the river too. So that's a little bit of a shift from the one you heard earlier, but participant engagement is going to be important, the facilitated feedback, and then of course I talked a little bit about the camp responsibilities. Longer term, couples and pets, we know that's successful. We heard that earlier. And then eligibility, we know there's some high profile camps that we want to work with initially, but eligibility is something that we'll hone in on as we start to transition people through the Safe Camp. And then of course, this will all be working with the Built for Zero project and our community partners. This is the pilot location. It looks weird because it's shoved up to the north end of the bowl. But that again goes to the fact that while we're housing people here, we're going to have the development of a longer term project in the middle. This is draft. I don't want to get into the nitty gritty on this, but it contains the elements that were mentioned in the previous slide. So I think that's the key success there. I'll move forward so you can see what it would look like. So here we show the larger, more conceptual plan for a longer term facility. It's got the space for emergency access. That's really been one of our toughest parts of this, is trying to find out how to house people while we can still get emergency vehicles into, and darn it, if fire trucks are smaller, it might be easier, but they are not. And so, and helicopters really aren't the option, but this is the longer term model that we'll be developing towards. And this is flexible. I mean, as we go through this process, maybe tent sites aren't it, maybe it's a tiny home scenario, who knows, but we're willing to learn and adapt as we go. Here is an example of this is a visualization of like the tent pad. We know that we are looking at a 10 by 10 footprint for each tent pad. Each camp participant would be assigned their own pad, which would have a designated tent. We know that to the community, aesthetics and the consistency and look and feel of the camp is going to be important. So storage is also an element in there. We're looking at the infrastructure to be run in there to include electricity, some sewer connections, water connections, internet, ADA, things like that. Storage, of course, and then fencing, because we do want that controlled ingress and egress. It's not going to be a free-for-all. So the fencing is a key component. We're looking at several different designs for the tent pads. I don't want to get into the weeds, but obviously proper drainage is going to be something we want to figure out with hot and cold weather. We have the extremes unlike Florida, so we want to take all of that into consideration. So anyway, and then we're looking at a larger shade structure in the middle. When we move into the more permanent or longer term solution, here's some of the things I mentioned. I won't dwell on that, but the shade structure gives us kind of a community space as we look into that longer term facility. That gives us more of an area where it's a multi-use space. We can have protection from the elements. There can be, if it's really hot, really cold, summer wildfire smoke, you kind of have a communal gathering space. When it's safe to have meals moved inside, we could probably do that. Again, that's some of the longer term things that we're looking at that we've seen to be successful in other jurisdictions. So that was my quick and dirty overview of the SAFE camp that we're looking at, or SAFE camps, since it's two different iterations of this, but we all talked about a pilot program. And so really we knew that being expeditious was important, but we also wanted to be thoughtful. So that's why you see kind of this two-prong approach. We're gonna work hard to get all of the grading done before we move anybody in. Our goal, and dare I say early May, very early May is ambitious, but I think we can pull it off. That's contingent on some permitting, the grading, and then securing that construction road for folks. So with that, I'd be happy to take any questions that you have, and I will try to stop screen sharing. Okay.
Thank you very much for that. I appreciate that update. So a question that I had, so the main structure at the shelter opens mid-May, but actually for those not associated with VOA living in the temporary tents or at Record Street, the opening for the general houseless population, those along the river and the park, is going to be probably about the same timeline I think that you're kind of outlining there, end of April, beginning of May. Does your, and I understand this Nevada Cares campus temporary safe camp is, its location is not ideal because of all the work that's going on in the bowl, but it's still going to occur at that early May timeline. You made a comment about pets and couples in the future. Did you mean at this temporary? They can have pets and couples.
So the thing we're worried about with pets in the first iteration, the kind of the northern end, up in the end that right away there, is it's going to be tough. It's going to be tough to keep people kind of contained in there while the construction's happening in the bowl. I mean, we're not going to have a ton of construction, but I don't know how we would keep pets from running into that area. So the soon, right now situation probably won't have pets. We're trying to figure out how that will look, but definitely into the one that's being put into the bowl. So the longer term one, definitely pets. I believe couples will likely, be good out of the gate, but I don't see why they wouldn't. But pets is something that is going to be troublesome when we have an active construction site sort of next door. That's been our biggest issue, and that's what gives our internal folks a lot of pause, is that you're going to have this temporary site there, and trust me, we've looked where else we could do it, how the timing could all work out. It's just that the running of the utilities into that bowl is not something that can be done quickly, and it's expensive. So the temporary one up north, no pets right now. The permanent solution or more longer term, absolutely.
Okay, because I'm wondering if and while it wouldn't be ideal, and I understand the complexities of the pets issue, because that is something VOA is trying to find their way through for the similar sort of reasoning, is safety and vaccination and security of the pets against other pets and clients, and how do they keep them separated and how do they, but accessible. So I mean, I'm disappointed that the temporary version won't have pets because that was a point of a significant barrier for individuals to come off of the river or out of the parks to begin with, was because they couldn't bring their pets with them. So I'm hopeful that the main campus maybe can act as a somewhere where those individuals who are in the tents can have their pets in some fashion. I'm just trying to find a solution in the short term, because I think tell me what the distance is between May of this year, which is our temporary quick solution, and the longer term with the pets solution. What's that time frame?
So the temporary solution is not going to get us into winter. So we need to get that more permanent longer term up. We're looking at November, 1st of November. Okay. Yeah, so not a ton of time. And we have done pets. We're doing them at our place. So we've got the framework. So it's not it's not an issue of trying to figure out how. It's just an issue of having them in the temporary facility while the construction is happening.
Yeah, I understand. I'm just trying to see if there's some other on-property solution that may not be ideal, but might be workable in the short term. I'm just trying to
and we can certainly collaborate on that.
Absolutely. Fantastic. Any other members have any questions or comments? I know we're dropping people because I think we're a couple minutes over. Do any members have any questions about the Nevada Cares Campus Safe Camp temporary or permanent program at this time? I got a thumbs up from Member Dare. I see Manager Brown, County Manager Brown came off of mute.
I've got about minutes left and then I have to go, Naoma.
Okay.
Thanks.
Mr. Brown, you're up.
All right, well, I'll make it quick. Thanks. Just as an update on the transition of regional responsibilities, I think we're making great progress. We've had discussions with our jurisdictional partners, staff in Reno and Sparks, where we've begun roughing out what an interlocal agreement might look like in that environment. Within the county, we have a staffing plan that we have developed and formed out and is being in the process of being shared with the commissioners. We are planning to include this in our proposed budget for the new fiscal year starting in July. So as you all know, you're on similar timelines. That means it will be presented on the, I believe the 20th of this month, in the next couple of weeks. So progress is being made. We are continuing to work through what are the uncertainties around the new men's campus, as has been mentioned earlier, from an operational cost standpoint. I think our plan would be obviously to continue to collaborate with the other jurisdictions as we form that up. But the timing of when those numbers will become available is probably going to be after the time that we have to have approved budget. So we have to have some flexibility around American Rescue Plan funding and other sources to make some of those take care of some of those one-time costs. That's really it, Madam Chair, unless there are any questions.
Thank you very much. Do any of our members have any questions or comments on this item at this time? Okay, seeing none. Thank you very much, Manager Brown, for all of your work, and Neil, Manager Kreutz, for all of your work, and Kate, and County Assistant City Manager Thomas. I'm going to stop with titles because I just can't think of all of them. Thank you very much for all your work on this. The monumental steps that have been taken on this front can't be overstated. This is big for our region, not just the Nevada Cares Campus, but the transition of leadership on the operations and the continuum of care to the county, I know is something that the city has been wanting and advocating for some time. So to see this starting to come to fruition is really incredible, and I appreciate your leadership Manager Brown on that front. That's very much appreciated, very much.
Thank you, but I really want to applaud my peers in Reno and Sparks also. This is, as was said earlier, we can't do this individually. We've learned that. So the level of collaboration has been fantastic, and we're looking forward to that continuing.
Thank you very much. Okay, Madam Clerk, do we have any public comment on this item?
We do not, Madam Chair.
All right, we are now going to move into item 11, board member announcements and updates, including future agenda items. Okay, I don't see any hands raised. I just, for quick board updates, Member Hill and I met with a great group of lived experience individuals, those that had been homeless for years and had been through the process. They gave some great insights, not just to the Nevada Cares campus, but to homelessness overall, because they have walked that path. And they had great feedback. I think they are a tremendous resource for, like I said, not just the campus and its evolution, but for homelessness in our region overall. I think there is tremendous value in continuing to collaborate with that group. Maybe we'll have someone from that group give a presentation here as we move forward, and it's not a formalized sort of noticed group that's been meeting. So we can probably swap members of the CHAB out who can participate if they would like to. But I thought it was very, very valuable. So that's my update. Okay, Madam Clerk, do we have any closing public comment?
Madam Chair, we received general closing public comment from Dawn Houtling. She has questions regarding homeless services in the North Valleys. That has been sent to the board as part of the official record.
Thank you very much. Okay, at this time we'll be looking for a motion to adjourn.
So moved.
Second.
We have a motion and a second. We are adjourned. Thanks, everybody.
Bye-bye.
Yep.